Hello everyone, I am Dr. M.D. Rashmi. I am consultant gynecologist and obstetrician in Apollo BGS Hospital, Mysore. Today we are concentrating on a little topic which most of the women all over the world are suffering from, and this symptom is mostly neglected, and this is called premenstrual tension syndrome. It's also commonly called as PMS or premenstrual syndrome. Premenstrual syndrome is nothing but a group of symptoms, either physical and emotional, in a woman after the period of ovulation and just before menstruation. This especially occurs 10 days prior to menstruation. The symptoms of PMS is divided into two groups, that is, one is emotional symptoms and the other is physical symptoms. Emotional symptoms include depression, helplessness, easy fatigability, and then crying episodes, irritability, mood swings, etc. Physical symptoms include feeling of bloating sensation, breast tenderness, and feeling of fullness, sometimes edema, and easy fatigability, etc. These symptoms occur every month in a specific sequence to every woman or most of the women. The severity of the symptom may vary from mild changes which are noticeable to very severe form where they need medical attention. And the severest form of this premenstrual tension syndrome is called premenstrual dysphoric disorder, where the woman is severely depressed, having mood swings and irritable, etc. And they need immediate medical attention, otherwise it may lead to even the physical damage. And this, what is the cause for this premenstrual tension syndrome? Actually, exact cause of this premenstrual tension syndrome is not known, but some of the causes are thought about. For example, one is chemical changes in the brain, for example alteration or fluctuations in the levels of serotonin, and the next is hormonal changes that occur with the cyclical menstruation, and these are the few causes which are objected to this, but exact causes again not known. How to diagnose this condition? The diagnosis mainly depends on the symptoms given by the patient. At least 2 menstrual cycles they have to record the symptoms and bring it to the doctor. There are no specific signs to elicit during the examination by the doctor, and there are no specific lab tests to diagnose this disease. So it is mainly symptom based disease. The treatment of premenstrual syndrome include it all depends on the severity of the symptoms. If the symptoms are, whether it is severe or mild, the mainstay of treatment is lifestyle modification. Lifestyle modification include modification of the diet, incorporation of the exercise into your regular lifestyle, and also reduction of the stress. Diet modification include eat small, more frequent meals to avoid bloating sensation, and restrict salt intake in the diet so that the fluid retention also reduces, and include more vegetables and fruits and food with more fibers, and also include whole grains into the food what you eat instead of refined food, and also reduce carbohydrate and salt intake. Next is exercise. Exercises and also include calcium rich diet in the food. At least 30 minutes of exercise in a day for 5 days in a week should be included in the daily regimen, so that we maintain our health and avoid all this bloating sensation and easy fatigability, joint pain, muscle weakness, etc. And reduction of the stress. This is a very important aspect of management of premenstrual tension syndrome. Stress can be reduced by modifications of our work style and scheduling our work, and also incorporation of the yoga and deep breathing exercises like pranayama into our daily routine. Then comes the medication. As I said, the premenstrual tension syndrome is treated depending on the severity. If the symptoms are severe, you may need medication. Medication include NSAIDs, that is painkillers what we give to reduce the pain, and also especially the breast pain, etc., and antidepressants if the symptoms are very severe. And also we may include the supplementation with vitamins and calcium. So the premenstrual tension syndrome is a treatable form of disease, and it's not to be scared of, or it is not to be hidden. First we have to understand, when many women go on suffering with premenstrual tension syndrome without understanding what is going on with them. So the main thing is understand the problem, understand that there is a condition called premenstrual tension syndrome, and it is quite treatable. Thank you.